So I think many healthcare professionals feel hesitant about taking on the burden or the perceived burden of caring for someone with a substance use disorder. And I think many times our experience is shaped by people we've cared for in hospitals or in emergency departments. And often people who end up in hospitals or emergency departments are the sickest of the population of people who are facing addiction. And during our training, or if we're working in hospitals as hospitalists or emergency medicine physicians, begin to believe that every patient with a substance use disorder is as severely affected as the people we have seen who are hospitalized in emergency departments. Like every other disease or health problem, there is real heterogeneity to the severity of illness. Some people with substance use disorders are much less sick in terms of their addiction, and some people are more sick. And so stepping into it as a healthcare provider, I would encourage people to think about it like diabetes or like high blood pressure, again, from my vantage point as an internist, where there's tremendous heterogeneity. Doesn't mean you need to feel comfortable caring for every single person with that disease. Sometimes you might want to involve a specialist or refer to a specialist because as a generalist it may not be within your comfort zone. Similar to diabetes, where as a primary care doc I was pretty confident in taking care of about 75 or 80% of diabetics, and the sickest 20% I wanted to have input from my endocrinology colleagues. So that's one thing. I think the other thing is that, again, based on our own clinical experience, we haven't often seen enough examples of people who get better and do extremely well with effective treatment, and in particular pharmacotherapy like methadone or buprenorphine. So again, experiencing that clinically, watching someone go from having very uncontrolled disease, uncontrolled addiction, to being in a more stable, solid place in their life gives you, and I guess I want other people to hear this and have the confidence to say, this is what may well happen with this person I'm treating, and to know that that folks can get better. And I think until you see that and personally experience that as a clinician, it's hard. It can be hard to imagine. And so trying to take care of folks with addictions will certainly lead to some of your patients doing extremely well, and I think that's also important to know and realize. Finally, I think we learn to take care of really complicated illnesses in internal medicine. Many organ systems affected, many things to balance, many social issues to contend with, and addiction is no harder. And there is this, I think, perception that people will come and have a lot of chaos around them and cause chaos in the person's practice, as well as in the patient-doctor relationship. And my own experience is that certainly that does happen sometimes, but it's by no means the rule. And in my primary care practice, I took care of many, many patients with buprenorphine with whom I had long-standing relationships over many years, and very little of the tumult that I think many clinicians are afraid of.